Okay, we're going to get started. So we've got 34 attendees. Woohoo! Welcome to session number 252, Reclaiming Your Sexual Self After Cancer. We are so pleased and thankful to have Marloe Esch with us. She is a BSN RN and an oncology certified nurse and a young adult cancer survivor herself. Currently works as a breast care nurse navigator in Milwaukee, Wisconsin. She's an enthusiastic advocate for sexual health and wellness, and Marloe has made it her mission to bring sex into the survivorship spotlight. She has presented on this topic for such organizations as the Youth Survival Coalition, the Oncology Nursing Society, and Planned Parenthood of Wisconsin, among others, and is a regular contributing author on issues pertaining to sexuality for the national AYA publication, Elephants and Tea. She holds certificates in both sexuality education and sexuality counseling through the University of Michigan Sexual Health Certificate Program, and presently serves on the board of directors for the Scientific Network on Female Sexual Health and Cancer. So I am just your facilitator, so I'm going to be quiet. I'll be keeping track of questions. Let Marloe get through her presentation, and then at the end, we'll take those questions. So passing it to you, Marloe.
Awesome. Hey guys, good afternoon. Thank you so much for choosing to spend a little bit of your time this afternoon with me talking about claiming your sexual self after cancer, which is a big statement, but we're going to kind of try and break it down a little bit today. As it was said in the introduction, this is something that I'm super passionate about, and I'm really excited for the opportunity to be able to address this important quality of life issue today, because we do know that most people who are diagnosed with cancer do report experience changes in their sexual lives and in their intimate relationships at some point, either during treatment or after treatment. And this includes both men and women. This stretches across the different types of cancer diagnoses and the different types of treatment modalities. So it's a really, really important topic. So thanks again for joining me, and I want to get started. So goals for today are pretty simple. Basically, I just want to open the door to a discussion about sex. I want to help you guys get a better understanding about some of the sexual changes that can occur with cancer and why they might occur, and then talk about some ideas about how to manage these common challenges. And certainly, where you're going to be able to go to get a little bit more help. Like I said, I could talk about this all day long. I could do a 3-day conference just on this, but we've got an hour, so I'm going to try and make it a Cliff Notes version, and then specific questions or concerns that you might be having, I want to provide some opportunities for you to find resources for those at the end. So I do want to start with a quick little mental exercise, and I just want you to think for a minute about what comes to mind for you when you hear the term sexuality. Just think for a minute. And I think most of the time when people think about sex or think about sexuality, a couple of things come to mind. One, reproduction, right? That's kind of linked with sex, but then also sexual functioning. So our ability to engage in sexual activities, our body's physical sexual response. And, this includes desire, so our interest in sex, sexual thoughts, attraction, that idea of being in the mood for activities. Physical arousal is another component of that sexual function aspect of sexuality. So the body's response to mental and physical sexual stimulation with increasing blood flow to the genital area and, erection, vaginal lubrication, and some other physical changes that can occur. Sexual response also can include the experience of orgasm, although it doesn't have to. Basically, orgasms are just reflexes in response to nerve stimulation that cause multiple muscle contractions, and we interpret those as super intensely pleasurable. Often those occur, of course, with ejaculation for men. Typically for women, though, it takes a little bit more practice to learn how to trigger that reflex. And for most women, it typically requires stimulation of the clitoris. The other thing that plays a big role in sexual response are hormones. So love them or hate them, the truth is that we need them. And as you probably know, hormones are those chemical messengers secreted by a number of different glands in our bodies. And they exert their effects on many different body systems and help with many different body functions. So when we think of sexual functioning, typically testosterone comes to mind as the male hormone, quote unquote, and estrogen comes to mind as the female hormone. But interestingly, both of those hormones play a role in sexual functioning for both men and women. And in addition to those sex hormones, there are a slew of other hormones that influence sexual response, including thyroid hormones, actually. So even though we don't think of thyroid hormones as sex hormones, imbalances in thyroid hormones can actually have a pretty profound effect, both directly and indirectly on sexual functioning. So the bottom line with sexual response is that it's complicated, especially the hormone aspect of things. The complexity of the interactions between the hormone pathways and the feedback loops and everything is fascinating, but it's beyond the scope of today's talk. So I'm not going to get into it. Basically, I just want you to remember that there are all of these nuanced interactions and going on in our body chemistry all the time. And they can account for a lot of the symptoms that we experience sexually and otherwise with cancer. So actually, these components of sexual response also really aren't in any particular order. And that's because, contrary to popular belief, sexual response really doesn't necessarily follow that linear stepwise pattern that we are taught to expect it to. First comes desire, then comes arousal, then if you're lucky, an orgasm, and then you go to bed. These are actually really dynamic relationships between all of these different components, and we're going to talk a little bit about that as well. But I think it's important to remember, when we think about some of the challenges that we might have in one of these particular areas of response, it's important to kind of look at these other components as well and how that might be feeding into it. So in addition to sexual responses and reproductive capability, I think it's also important to remember that our sexuality, part of our sexuality is our sexual self-concept. So this includes body image, sexual identity, how we see ourselves and feel about ourselves sexually. And then it also, it includes the components of our romantic and our sexual relationships. So those feelings of intimacy that we have, affection, love, trust, connection, they're not necessarily sexual, but they are part of what influences our sexual expression. And engaging in sexual activity is one of many ways that couples can also create and maintain intimacy in their relationship. So I like to draw out all of these concepts. I'm a hand talker, as you can probably tell, but I like to draw out all of these concepts and put them on one slide because I think it's really important to be able to conceptualize all of these connections and the scope of our sexual lives, all the different aspects that feed into our sexual experiences and into our relationships. I think all too often we have a really narrow definition of what sex is and what it means to have sex. So much so that we tend to lose sight of the different ways that we can experience sexual and sensual closeness and connection with our partners. That's kind of going to be the running theme of today, actually. So what does cancer have to do with all this? Well, a lot, actually, probably, or of course, which is you are probably aware of since you're here with me today. But, you know, mentally and emotionally, we are impacted by our cancer diagnosis and how we feel with it. That can impact our desire, that can impact how we feel about our bodies and the changes our bodies go through. Physically, certainly, you know, those hormone imbalances that can occur, physiological arousal changes, the way our bodies function, orgasm changes, and reproduction can be affected by all different kinds of cancer diagnoses. And then that whole, you know, intimacy realm, relationship dynamics can be changed as well. So, you know, some of these changes or concerns might be temporary, they might improve over time, but for a lot of people, the changes can be long-term and they can require a certain amount of work to adjust to and to find new ways to experience sexual pleasure after cancer. Luckily, our sexual lives are not at the mercy of a cancer diagnosis. And I do want to spend pretty much the rest of our time today talking about some ideas for managing common challenges after cancer. One of the things that I think deserves the most attention is the concept of desire. So that's where we're going to start. And I'm wondering if any of you guys can relate to this sentiment. I'd rather read a book. I found this quote in a book on intimacy and cancer, and I think it sums up the challenges that people often face with a loss of sexual desire really well. It tends to be about expectation and motivation. So, you know, we're taught to expect desire to be this spontaneous, gotta have it feeling that springs up in us and demands attention. And since we think of desire as something that is supposed to happen to us, you know, we don't really have the motivation or the know-how to kind of go looking for it when it doesn't show up in the way that we think that it should. And that can make us feel, you know, like something's wrong with us, something's broken. It can be really disappointing and hard to know where to go. In reality, how we experience sexual desire is much more nuanced. It's complex, it's circumstance dependent, it's influenced by a lot of different factors, and our brains are actually the ultimate control system of all of this. Because of that, I do like to call the brain the B spot, if you will, and I want to talk a little bit more about what that actually means. So, the dual control model of sexual desire says that there are two different kinds of pathways when it comes to sexual motivation or sexual interest. First, there is the sexual accelerator pathway, and that's activated by all the things that we find sexually arousing, things that motivate us to seek sexual pleasure. So these can be thoughts and feelings, or they can be physical sensations that are interpreted as pleasurable. And then the second control system are the sexual breaks. So they're activated by anything that makes sex seem unappealing, unimportant. Stress, worry, fatigue, not feeling well. These can all be turnoffs or shutdowns of the sexual motivation system. So I kind of like to think about it as driving a car, right? So you got the gas pedal or the accelerator, all those things that might be turn-ons for you. And you got the brake pedal, which are all the things that halt the car or are turn-offs. And if you think about driving a car, if the brake is engaged, no matter how hard you step on the gas or try to accelerate, are you going to go anywhere? No, your car's stuck. So I think in a similar way, these desire control systems compete with one another. And if they're both being stimulated at the same time, the system that is inhibiting sexual desire, aka the brakes, tends to win out. And I do think this makes sense evolutionarily, right? You know, if our ancestors ignored signals of danger or distress, for example, so that they could get frisky, they probably wouldn't have lasted too long. But for us, it can be a big deal, it can be a big problem. So how do we get our brains on board then? If we can understand that it makes sense for our brains to put sex on the back burner when other things are demanding energy or attention, this also provides us with an opportunity actually to understand that we can intentionally create desire by bringing a focus back to our sexual self and to our sexual relationships. It's important, I think, to realize that needing to create that space for desire to grow doesn't mean that you're broken. It doesn't mean that something is wrong with your relationship. It just honestly means that you're human. So getting your sexual groove back, your desire back after cancer, you know, it can take some work, but it's really good work to do. And let's take a look at some of the ways that we can maybe ease up on our sexual brakes a little bit and learn how to put a little more pressure on the gas. First things first, acknowledging and addressing negative emotions. So as you all know, you know, there is a lot of mental and emotional baggage that comes with a cancer diagnosis. Anger, fear, sadness, grieving, changes to our bodies, uncertainties about the future, all of these things, they take up, you know, precious brain space and mental energy. So the very first step is to identify and address these stressors, which certainly is not easy. There really aren't quick fixes, but it's an important initial step, because no matter how much effort you try to put into any of the next suggestions or implementing any of the next things that we talk about, if there are things on your mind that are stressing you out, or hitting those sexual brakes, you're not going to be going anywhere. You're going to be spinning your wheels. So the first thing is giving yourself time, the time and the space to explore these and help work through some of them. I'm a super big proponent of expressing yourself creatively, especially through expressive writing, but really any creative avenue for getting whatever's kind of going on in your head out, and, you know, whether it's on paper or on canvas, can be really therapeutic and an important way to begin healing. Finding support, certainly, this can look like sharing concerns and feelings with your partner. Your partner can actually be, you know, super reassuring, and maybe will help you be able to see some things in a new light and a different perspective. Certainly, you know, joining a support group or talking to someone else who's been there as well can be super helpful. And then, of course, seeking professional help so that you can kind of work to kind of build some coping skills and kind of work through some of these more negative roadblocks. You know, mental roadblocks can be a really good idea as well. And often, you know, your cancer center often has, you know, in-person counselors or therapists available, but certainly online there's a lot of communities with professional help as well, which, you know, include cancer care, which I have listed here. Next, I want to talk about growing your body confidence. Our sexual interest is closely connected to how we feel about our bodies, whether or not we feel desirable or desired. And so if we're uncomfortable with or we're embarrassed about certain aspects of our bodies, it can be really, really hard to share that part of ourselves with another person, or to find joy and pleasure in doing so. So growing body confidence after cancer, you know, it requires us not only to accept some of the changes we might have experienced, but also to be able to find an appreciation for what our bodies can do, and find some ways to celebrate what we're capable of. So this is also not a quick fix. This also takes time and hard work. But if you think about it, you're inhabiting the only body that you're ever going to have. And so it's really worth the effort to try and make some peace and find joy in it. So how do we do that? Tall order. Certainly, anything that's good for your mental and your physical health is also good for your sexual health. Doing things outside of the bedroom that help you feel accomplished can also support confidence inside the bedroom. So engaging in hobbies, stress relief, exercise, eating right, all of those things provide a good framework for learning body confidence. Self-compassion is a really great skill to build and to practice. Basically, it just means unlearning negative thinking patterns and self-talk, and kind of relearning how to offer yourself the same sorts of kindness and non-judgmental understanding that you would offer to any other person. Dr. Kristen Neff has done a lot of research on this, and she's got a website with some great exercises, in addition to a couple of other exercises I put on here as well for you to kind of take a look at. Looking through the friend lens, it can be a really good thing to kind of change your perspective a little bit, or see things from a little bit different angle. We're much more critical of ourselves than we are of others, including our friends. So it can be really helpful to think about, how would I respond to a friend who, came to me with the same sorts of concerns or judgments that I'm feeling right now about myself. And kind of in that same vein, taking your partner's perspective can be really helpful as well. We tend to focus on what's changed about our bodies and what we've lost, but our partners and other people in general tend to take in the whole package. So if you can ask your partner or another loved one to reflect back to you what they see when they look at you, all the reasons that they love you and what they love about who you are, that can be really reaffirming. And I would also recommend that you maybe respond to them in kind and let them know what you see when you look at them too. It can be a great way to build connection. Lastly, I think it's important to begin to rediscover your body as a source of pleasure. So things change after cancer. Our bodies often feel medicalized, and it can be hard to kind of get back into the groove of realizing that touch can be pleasurable and enjoyable. So one of the things I do often recommend is just exploring with self-touch, sexual touch, as an opportunity to see how your body has changed, maybe what feels good, what doesn't feel good. And that's especially valuable without a partner, because then you don't really have that pressure of performance necessarily, and you can kind of explore some of the changes on your own. I also put sensate focus in here. Sensate focus is a therapeutic technique, and rather than a solo experience, it's meant for partners or couples. And it's basically a series of steps or a series of exercises that help couples kind of relearn how to connect with one another and relearn how to enjoy physical touch, sensual touch, not sexual touch, but sensual touch. Excuse me, with one another. So it can be a really valuable tool as well. Certainly, decreasing distractions, tuning into turn-ons can be an important part of kind of identifying desire. Our brains are used to going 1,000,000 miles an hour and sorting through this never-ending array of bombardment of signals, right? But multitasking doesn't work when it comes to sex. Sexual desire is really fragile. Sexual signals, typically are just these little like blips on a radar full of other louder, more demanding, more break activating signals, like laundry and deadlines and questions about wondering if your partner sees your belly flap. So it's really important to learn how to kind of cut through all of that static enough to be able to notice and nurture those little blips of sexual interest. One of the tools that can be super useful is the idea of mindfulness. Being mindful improves our ability to kind of tune out the distractions and then tune into, those pleasurable sensations that are happening in the moment, in the current moment right now, whether they're physical or emotional. And that can really allow desire to kind of snowball. I also put sensate focus exercises on this slide as well. To me, sensate focus is kind of like a mindfulness exercise because one of the goals is just learning how to notice what touch feels like and how it makes you feel. And that can be a good way to help get those little blip signals noticed. So you might be thinking, but Marloe, how am I supposed to amplify sexual signals if they aren't even there in the first place? Right? A lot of people have that question. To which I say, you typically have to do a little bit of research. We might feel like sexual thoughts never cross our mind, but most of us have at least some fleeting sexual thought or feeling at least once in a while. And it's just a matter of our brains being super good at shutting them down, so much so that we hardly recognize them, hardly recognize our own arousal reactions sometimes. But those fleeting moments actually have a lot to teach us. The American Cancer Society had a really good idea, a really good exercise, which was keeping a desire diary. Basically, you're collecting data. So you just carry a piece of paper and a pencil around with you for a week or however long it takes to get some data. And whenever you have a sexual thought or a feeling, you write it down. You write down where you were, time of day, what you were doing, what triggered the thought, who you were with, all that good stuff. And you kind of start to look for patterns in places and people and times of day and situations. And you crunch the data, you analyze it, and you use what you've learned to put yourself and your partner in mood-enhancing situations or to kind of jumpstart your sexual imagination a little bit. The other thing that can be really helpful is this idea of taking advantage of your partner's libido. And this is typically called responsive desire. So it's the idea that if you make a conscious choice to respond openly to sexual suggestions from your partner, you can actually end up enjoying and finding pleasure in something that really wasn't even on your radar 2 minutes ago or 5 or 20 minutes ago. And, in fact, for women in particular, this is the primary way that desire is experienced. In comparison to like a spontaneous desire or drive. So, there are a lot of different reasons for initially engaging in sexual activity, and often desire kind of comes after you start initiating. The last thing that I kind of want to talk with you guys about regarding desire specifically and kind of how to cultivate it is this idea of using your imagination. So one of the very uniquely human things that our brains do every day is imagine stuff, right? We're really good at creating hypothetical situations, stories, anticipating what it would be like to experience a certain situation. And this can be really useful in our sex life. Sexual imagination, also known as sexual fantasy, is a really good way to stimulate our brain. Sexual thoughts open up those accelerator pathways. They encourage our brain to interpret, incoming signals as arousing, and that can kind of lead to this chain reaction of desire and arousal and excitement. Increasing eroticism is important as well. Eroticism is that kind of sense of sexual adventure and anticipation, and we're going to talk about this in a little bit. So I want to move on to getting our bodies on board. In some ways, utilizing strategies to build desire can actually also improve our body's physiological arousal responses. But I did want to touch on a couple of some of the more common changes or physical functioning changes that men and women can experience or might notice that can be bothersome or frustrating when it comes to their sexual functioning. From women, vaginal dryness is really common. Vulvovaginal dryness and tissue changes like thinning and loss of elasticity are common symptoms of estrogen loss, and they can contribute to painful or uncomfortable sex, as well as just general bothersome symptoms like itching, irritation, that kind of thing. And, you know, low estrogen levels, they occur naturally at different times in our lives, including, you know, like breastfeeding, when we're breastfeeding, as well as postmenopausally. But they can also occur with different kinds of cancer treatments that impact hormone levels or cause imbalances in hormone levels. Luckily, there are several simple strategies that can be really effective in improving these bothersome symptoms. So first thing that's usually recommended are vaginal moisturizers. So I think M for maintenance moisturizers. And they're meant to maintain vaginal health and comfort after this type of estrogen loss. And basically, they just help trap moisture into vaginal tissue. So they're kind of like lotion for your vagina, but don't use lotion, use vaginal moisturizers. But that's the same idea. They're non-hormonal, they're over the counter. You can look for ones with certain ingredients that might be that might work a little bit better. And basically they're, you know, applied to the vaginal tissue a couple of times a week, and they do a really good job of preventing some of those day-to-day irritation symptoms from dryness. Vaginal lubricants are more of an as-needed thing. So lubricants for loving, they're for sexual touch. They're designed to decrease friction, make sexual touch a lot more comfortable, and basically you use them with sexual activity. You apply to your vulva, internally to your vagina, to your partner, to anything, you know, that is going to be part of your sexual activity for that day. There are a ton of vaginal lubricants, personal lubricants, I guess I should say. And so it can be really important to do your research and to experiment with what works for you. Typically, water-based or silicone-based are generally recommended over oil-based. And then another rule of thumb is to kind of avoid, you know, avoiding a lot of extras. So avoiding, you know, warming additives, scents, flavors. Glycerin can sometimes be irritating for women. Natural oils we tend to recommend avoiding as well. So, you know, doing some research online, I have some really good resources, websites for some resources for you guys to kind of take a look at as well. But talking to someone at one of your local trusted erotic boutiques as well can be really helpful and help you kind of figuring out what's what. Lastly, for vaginal dryness, vaginal estrogen, so topical estrogen can come in cream forms, rings, tablets, gels, and it's estrogen that kind of just has an effect locally, so on your vulvovaginal tissue. It does require a prescription, and so it is something that you would have to talk to a provider about, but it's a very effective treatment for some of those changes. For men, erection difficulties can be fairly common with cancer and with a lot of the hormone changes that come along with cancer. Good erectile function requires healthy nerves, healthy blood vessels, healthy hormone levels, And there are several strategies that can help promote erections. First of all, if the problem is related to unbalanced hormone levels, making sure to restoring those levels can be super effective. Studies that have found that for men with thyroid cancers who are experiencing sexual dysfunction or erectile issues, restoring the thyroid hormone levels often significantly improves or resolves the sexual side effects that they've been having without the need for additional sexual therapies or medication. And my guess is if you're on thyroid hormone replacement medication, your levels are being pretty closely monitored by your provider. But then in addition to thyroid hormone levels, if a man is having a problem with erections, often they will also check testosterone levels as well. In addition to that, just overall healthy lifestyle maintenance is really important to erectile functioning. A lot of chronic health issues can impact erectile function, like things that damage blood vessels and the nerves responsible for erection. So heart disease, smoking, diabetes, just to name a few. So those lifestyle modifications, diet, exercise, smoking cessation, those can all help to maintain and promote the ability to obtain an erection. For men who are interested in additional intervention, of course, there are medication options. I think we all have heard or seen advertisements for some of those oral medications like Viagra and similar ones. I would really caution against the use of natural herbal supplements or enhancement aids that you don't receive from a doctor's prescription or from a trusted pharmacy, just because they're unregulated. They tend to be unregulated. They might have unknown ingredients or unknown dosing, and they can actually interact in unsafe ways with other medications that you might be taking. So talk with your healthcare provider if you're interested in either taking a prescription medication or if you're interested in taking an over-the-counter option that you might have identified, just to see if it would be safe for you. In addition to the oral pills, there are local treatments, including injections of medication into the penile tissue, or inserting urethral pellets that actually act locally on the erectile tissue of the penis to help cause an erection. And then, for men who, have tried prescription medications and that didn't work, or maybe have contraindications for taking medications, there are mechanical aids that are available. And those do include the vacuum erection devices, which they just work to pull blood into the erectile tissue to create an erection. And then certainly there are surgical implants. And that's, a more invasive route, but it can be very effective as well. And I would typically recommend just talking with your doctor about any or all of these recommendations. They typically kind of have a stepwise approach to options that they try. And often it's a combination. So, a combination approach using a couple of different options or things, and it might be trial and error a little bit too to see what would work for you. Fortunately, there's no magic pill or typically, so it can take a little work to figure things out. All right, time for a quick pop quiz. Men need to have an erection in order to experience an orgasm. True or false? So it's false. Orgasms are controlled by different nerves than those that are involved with erection. So this means just like you can have an erection without experiencing an orgasm, you can experience an orgasm without having an erection. And this is one of my favorite factoids. Sometimes erections can be unreliable, right? Especially as men age or with certain illnesses or medications. But, penetration is not a requirement for sexual experiences to be enjoyable, and it really shouldn't be the end goal. In fact, for women, the vagina has relatively few nerves in comparison to the clitoris, and that means that the clitoris is typically much more important to pleasure than vaginal penetration anyway. So basically, it's important to keep in mind that people can have a really good time, regardless of the presence or the absence of an erection. And this is just one example of ways that we can expand our ideas or our definitions of what sex can look like for us and for our partners. Speaking of partners and partnered sexual encounters, that does bring me to kind of the last segment for today, which is relationships. If you're in a relationship, it's likely that your cancer diagnosis has affected not just you, but also your partner and probably how you relate to one another. If you're not in a relationship right now, cancer can certainly affect how you approach dating and potential partners. So I want to take a few minutes to look at some ideas for building and maintaining strong relationships after cancer. As we reviewed earlier, intimacy and sex are not the same thing, but they can work together. Those feelings of emotional intimacy, such as understanding, affection, trust, they can motivate us to seek physical intimacy, and sharing sexual experiences together can help grow emotional intimacy. Sometimes if couples experience a pause in their sex lives, including maybe with cancer diagnosis or treatment, their emotional connection and closeness can unravel a little bit. And I can't stress enough that it's really, really important to keep that intimacy bridge open as much as you can when you're crossing the waters of cancer. What I mean by that is, if sex isn't in the cards for you physically in that moment, finding ways to maintain or even grow your emotional relationship can help rekindle the sexual aspect of your relationship down the road. So some things that you can do, evaluate your personal accelerators and brakes like we talked about, and then be really clear about your needs. Make suggestions for your partner. So you could say, I'm not up for sex tonight, but I miss feeling close. Can we snuggle and watch a movie? In that one sentence, you set an expectation, you let your partner know what your need was, and you also gave them a suggestion as to how they can fill it, which can be really important ways to kind of keep that intimacy. Make sure that you prioritize spending time together, making space for one another, and exploring activities that you really both enjoy doing. It's important to make new, relaxing, fun memories as a way to keep that connection when you're going through some difficult times. Certainly, embracing physical affection and touch are really important. Holding hands, hugging, cuddling, massage, kisses. A lot of times, we'll avoid physical affection, any type of physical affection, because we're afraid of giving our partner the wrong idea or leading them on or something like that, disappointing them. But it is those kinds of non-physical connections that actually, help build that bridge of intimacy, making it a little bit easier to find your way back to sexual touch when you're ready. So when you do feel ready, what are some strategies for successfully integrating sexual experiences back into your routine? Starting things slowly, setting limits can help take the pressure off of being close again, making sure that you have time, making sure you're not going to be interrupted, that you have enough privacy. We talked a little bit about setting those limits and boundaries beforehand. And that can help just promote relaxation during the experience and prevent mismatched expectations and frustration. Embracing planning and preparation. For a lot of different reasons, sexual spontaneity may not be possible, but that certainly doesn't make sexual sharing any less enjoyable. And contrary to the idea that preparation kills the mood, planning, I think, actually can create excitement and anticipation about what's to come. You know, it promotes success when you actually are able to engage in sexual encounters. And I think being intentional about your sex life shows a commitment to making things work. Humans love routine, right? Many couples over time tend to kind of slip into sexual routines or sexual scripts. And when something in that routine no longer works or isn't possible, it can be hard to kind of figure out alternatives. Adapting to changes may require you to experiment a little bit, flip your sexual script, redefine what sex means to you and what's possible. I think it's really important to focus on pleasure, playfulness instead of performance. You know, we talked about that idea of penetration not being the goal. And doing that opens up, you know, a lot of opportunity for exploring eroticism, variety, the spice of life. Variety is the spice of life and in sex, I like to say. But I put this other course, there's a handout on a lot of different alternatives to penetration that you can go to this website and look at this awesome handout from A Woman's Touch for some ideas. Certainly communicate, communicate, communicate. So doing all of these things, you know, requires us to be able to have conversations with our partners about sex. But that can be really hard. Most of us have never been given very detailed roadmaps on how to navigate these kinds of discussions. So it's really, you know, it makes sense that doing so is nerve-wracking. But it's important. So let's talk about some ways that you can be heard. Honesty. Honesty is the best policy, right? Often we avoid the topic of sex altogether because we're afraid of embarrassing our partner or hurting their feelings, but staying silent does not do anything to address the problem. Typically it makes it worse. And it also doesn't give your partner the opportunity to kind of lend you support, reassurance, and help you brainstorm some ideas about how to handle certain concerns. So being honest and truthful about your feelings and about your needs prevents, you know, misunderstanding and confusion and frustration. Choose when and where you're going to be having this conversation, preferably not just before or just after a sexual encounter, but somewhere outside of the bedroom, somewhere a little bit more neutral, like maybe the kitchen table over coffee or something like that. Making sure you have enough privacy and enough time to have your conversation. And I really would encourage it to be face-to-face rather than text. It can be a little scary face-to-face, but I think it's a really important conversation to have one-on-one in person. Communication is a two-way street, so I would definitely encourage you to ask your partner's perspective. It can be really valuable. They can help provide insights into things that you might not have thought about before, and it can provide reassurance regarding some of your worries. You know, going along with enlisting your partner's perspective, making sure that you respect their point of view. We know that it's vulnerable and, you know, difficult to have those conversations. So just making sure that you're respecting what they're saying. Reflective listening can be a really important way to make sure that you're understanding what your partner is saying and also that they're understanding what you're saying. So just, you know, reflecting back to them what you think you heard and asking for clarification. And then reinforcing the good. So framing things or concerns in ways that reinforce the good things. Which might be something like, you know, I really loved when we used to XYZ and I miss it. You know, what are some ideas that you might have for helping us, you know, get back to that place? And then details. Typically, when it comes to communication about sex, we are used to relying on nonverbal cues. You know, those side glances, the sexy smile, the occasional ooh nah. to get your point across. But your partner is not a mind reader. So do not be afraid to state the things that you might feel are obvious. Chances are, what's obvious to you is not so obvious to your partner, and they really will appreciate the specifics that you're able to give them. I want to touch really quick on dating after cancer. Dating in general is stressful, but after cancer, it can be really scary to kind of get back out there. And one of the most common concerns that I hear is this idea of trying to figure out how and when and where to share your cancer history with a potential partner. So, the good news is, or maybe the bad news is that there really isn't one right way to do it. But there are a few things that can make disclosure go as smoothly as possible. And one of them is timing. So, I would recommend waiting until you've hung out with the person at least once or twice and kind of made the judgment call that, yeah, you can see yourself with them, creating a relationship with them. If you think, yeah, this person is really rad and I want to continue to get to know them, then, I think that's the point where you can consider sharing the pertinent aspects of your cancer. And, before you're invested, but after you build a little trust, can look different for everybody. And when you have that gut feeling that it's the right time, if they, how would I want them to do it, or would I appreciate?
Okay, I don't know if anybody can hear me, but we've lost sound. Marloe, I'm asking you I'm sending you an ask to unmute request. So let's see. I'm gonna try making you the host.
Can you hear me now?
Yes, I can hear you now.
I'm sorry. How long was I out?
I don't know, maybe a minute and a half, 2 minutes.
Bummer. Well, we're getting to the end. Should I power through, or are there questions?
Well, there are some questions, so
okay.
I think maybe we should. A lot of the questions are lost audio.
Oh no.
That's okay. So one of the questions is, can you recommend a book that explores non-penetrative sex for heterosexual couples?
Tell you what.
There we go. Yep, we can see it.
See it? Okay.
Mm-hmm.
These are, so if you feel like you'd still rather read a book, these are some really, really good resources for some, taking that wide scope on sexual activity. Come As You Are by Emily Nagoski is awesome. Sex Matters for Women. And then there are some sexuality specific books as well. So, Man Cancer Sex, Women Cancer Sex by Dr. Ann Katz are great. And so, those would be some places that I would start. The women's, on these sexuality resources, A Woman's Touch. So it's a few bullet points down, the sexuality resources, educational resources. They have so many amazing resources about all different kinds of things sexuality related, and that's where that other course information is. And so I would also maybe start there as well.
Okay, awesome resources on the screen. So somebody is asking about, they started dating somebody just a couple months before going through surgery, and the cancer was found kind of unexpectedly. And it sounds like her partner's been wonderful, but she thinks that maybe the cancer has made him feel a little bit different about her sexually. And he's even said that maybe he feels that she's a little fragile.
Mm-hmm.
and that the sex life hasn't gotten back to where it was.
Yeah.
Still very affectionate, and I guess I shouldn't assume that this is a heterosexual couple, but I'm just kind of interpreting what I'm reading on the screen. But anyway, this couple is having issues. Are there any suggestions?
So and suggestions for kind of getting back to where you were a little bit. Is that kind of what you're thinking the question is?
Yeah.
You know, it's really common for that relationship dynamic to change a little bit. So a lot of times when people are in a relationship and then, you know, one of the partners goes through a cancer diagnosis, their dynamic can change from equal sexual partners to kind of this caregiver provider dynamic a little bit, and that can be kind of a hard bump to get over. And it kind of sounds like that's what this person is talking about when she feels like her partner thinks that she's kind of fragile. And to that, I think, you know, one of the most important things about addressing any changes is the communication piece. So I think it's really important for her. I'm wondering if she has expressed this
It did say in the
with her
question,
partner.
it said that they've spoken about it,
Okay.
a little bit about it.
The other thing is time. I mean, time can be a really important factor to healing in general. And so, you know, remembering, you know, some of the things that they did together that, you know, were fun and were intimate when they were first starting to date can be a good way to kind of try and get back into the groove, but it can take time. Unfortunately, yeah, not an uncommon issue.
And somebody wanted you to put the books page back up on the screen. This is the free downloadable, but you had a list of books.
Yeah.
Awesome. Okay, and then when you went mute there unexpectedly, you started to talk about like when you start dating after a cancer diagnosis, and I wanted to do just a touch more on what you were going to say.
So I would say, as a general rule, you know, it's a good idea to wait till you come out, maybe once or twice. And, you know, doing that can just allow you to kind of get a feel for whether or not the person is even worth your time, worth investing, you know, kind of emotionally divulging that information. So, you know, once you feel like, yeah, this person is rad, you know, this person is someone that I could really see myself building a relationship with, then I think it is important to consider sharing pertinent aspects of your cancer history with them. And the window to doing that is a little bit different, you know, for each individual or each situation. But I do think, you know, one of the more important things is just being able to do so honestly and when you feel like the time is right. Putting yourself in their shoes is important, can be a really good way of helping to understand their reaction a little bit and maybe accept it a little bit as well. Their reaction to your disclosure, you know, if you just consider if they had something that they were going to be sharing with you, how would you want to hear about it? What would you appreciate? What kind of time would you appreciate taking to consider things? Would you want to be by yourself for a while? Would you want to have time for questions? All of that kind of thing can make it easier to understand where they're coming from. Conveying confidence, I think, is really important. You know, you can't predict how somebody is going to take the news, but people do tend to read the room, you know, meaning that they often mirror the emotional cues and the attitude of the person that they're with. So if you're matter of fact, upbeat, you're comfortable with the conversation, then it's more likely that they will be as well. Keeping it simple is a good idea too, and just kind of letting their questions guide the discussion or how much detail you're going to be giving them. You know, you can start with the basics and just say, We've been having a lot of fun together. I'm really enjoying getting to know you. But there's something I'd like to share with you. You know, I had cancer X number of months or years ago. What kinds of questions do you have for me? You know, do you have any questions about that? I would definitely say, you know, don't worry if you're met with silence or there's some awkwardness or they seem a little bit uncomfortable or trying to teach the subject. That's totally normal. And you can just let them know that, you know, it's kind of a big piece of information and that you're there for them to answer questions whenever they are ready to talk about it. But on that same token, you know, don't ignore it. So, you know, pick it back up on a different day, ask them if they've thought any more about what you shared and what kinds of questions they have. And if they continue to avoid the topic completely or have negative reactions to it, they're probably not in a place where they're going to be able to support you in the ways that you deserve. And I certainly think it's, you know, good that you found out sooner than later. So that you don't have to continue wasting your time with someone who's not able to support you. I would also recommend making a game plan. So for certain responses that you might get, even if questions or comments from the person that you disclose to feel insensitive, chances are they're really not trying to be hurtful or mean. So I would just use their words as a starting point to engage in a conversation with them and as an opportunity to kind of clear up some of those misconceptions. You might get questions like, you might get statements like, I've never met someone with cancer before, or I can't date a sick person, or, you know, my cousin died of cancer. So just kind of thinking about how you might use those as learning moments and how you might respond to those types of responses. You might get questions like, so does this mean you can't have kids? Or are you going to die? Or why did you tell me that? So just kind of having in the back of your mind how you might handle those situations. And then practicing can be really helpful. So practicing, you know, even if it's just in a mirror or with a friend or a family member, can give you a little bit more confidence that you'll be able to handle any kind of response that you get as well.
So Marloe, we're gonna have to end it because we did go about 7 minutes over, and at 10 minutes over there will be a hard stop, and all of a sudden
okay.
I'll from cyberspace here. But I think it was okay that we went a touch over. We lost a little bit of time with the technical gremlins. There are some thank yous that have been popping into the question box. People seem to really appreciate the topic, and somebody mentioned that they don't recall this being addressed at previous conferences, and it's been a great addition, and people are saying thank you. So,
oh, great. Yeah, it's a huge topic. It's hard to distill down. So just, you know, explore those resources. And I don't know if there's a way for me to be able to provide a list of them for you guys, but I'd be happy to do that as well.
Well, this session was recorded and will be available to people to go back and find those resources. And I'm sure that ThyCa will make you know, like a list of books and the websites available.
Perfect. Sounds great. Well, thank you so much for having me. I really appreciate it. It's a lot of fun.
Appreciate it. Thank you, everybody, for attending, and see you at the conference.